seizure precautions. You pretty much know this one, but let me holler back at the girls and the boys. Look at what else it says for the seizure precautions. You're going to see something that says BEM. BEM is in the title of the seizure precautions. It says bedside EEG monitor, BEM. You see? That is what we do with these patients who come in and we don't know why they're seizing, just that they are. What did you have to remember? They got to wash their hair. We have to be able to stick the little probes on their hair and their scalp. It's a television that you have in the room with the patient, and we're watching that television, not you and I, but someone is watching that television 24/7, and you'll see the patient in the bed right here, and then you'll see all their brain waves going across here, and that's called BEM, okay? All right, so you gotta know that, all right? Bedside EEG monitoring. And then you see all the other rest of the stuff that goes with it, but even the thing of neon colors is on there. Do you see? Neon colors can give somebody a seizure. Blinking lights can give people seizures. Fluorescent lights can give people seizures, which is why you see a lot about the dimming the lights. And then the one you probably missed the most on the test is no TV. Yeah. ICP pressure precautions. Remember, anyone with a Glasgow less than 8 needs these. That was on the test. Glasgow less than 8 needs ICP precautions. And remember the rule and the rhyme. Glasgow less than 8 intubates. Glasgow less than 7 go to heaven. But call so we can keep your organs. Sorry. All right. So, all right. So now you see it says no, 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 no. All the no's are there together, right? Mm-hmm. Let's think about what we're doing with those no's, shall we? If we increase pressure in any part of my body, it's going to increase pressure in every part of my body. This brain of yours, when we talk ICP, has 3 components. The 3 components include cerebrospinal fluid, blood, and of course brain. Hello. These are the 3 components. And with these 3 components, an increase in any one of them will mean something has to decrease. That's bad. Because, for example, let's take your brain is swelling, which means that compartment increased. Y'all with me? Will this or this go down? Blood. So blood equates to what? Oxygen. If this goes down, it's going to do it by way of vasoconstriction. You're going to lose blood flow to the brain. You're going to have a behavioral change. Makes sense. Irritability, anxiety, confusion, LOC changes. It makes sense. Decrease oxygen to brain. We said that earlier. It's the first thing I said when you walked in. It's those behavior words on your pages at the top, right? It builds. That's why the Oh My God packet is totally your fucking test. Like if you really knew it, it's your test. But you guys look at page 3 and go, Okay, so again, if this goes up, this comes down. Let's do another one. My student was sitting way in the back of the class with her head down. She's a lot like me, kind of like hyper, bubbly, crazy. She usually comes in dressed to the nine, not me, not in the winter, never. But she comes in dressed to the nine, makeup done, and all the rest of the bullshit. Now, she come in looking like a little bum with the house shoes and everything. Okay. All right, whatever. She goes to the back seat. During my lecture, because I notice everything, she got her little head on the table, looking down and shit. What the fuck? So I decided to play a little trick. I said, okay, I know what. I'll say some shit she gotta look up for. I said, y'all see this right here? And I wrote some dumb shit. Y'all see that? That right there. I'm talking about that right there. She ain't even move. I'm like, fuck. That that shit down, walk to the back of the room. Baby, you okay? I'm all right. I just got a really bad headache and the lights hurt really bad. And I don't know, I probably shouldn't have came. It's like so loud. And I was like, oh, hell no. I said, so what's going on? Well, I've been having these really bad headaches. And first they thought it was my eyes. And then the other day, 2 days ago, which I know about that time frame. That motherfucking time frame. Yeah. 2 days ago, I had a lumbar puncture. What? She never said that shit in my class. Let's examine what I wrote. She had a lumbar puncture, a hole put in her back to get some cerebral spinal fluid. Okay. If this goes down, something got to go up. Blood. I said, oh my God, you had a lumbar puncture? Okay, you need to get out of here. And her friend, best friend, sitting next to her, needed to drive her to Hillcrest because either you're still leaking fluid, right? Because that could be a possibility. Or the fluid is accumulating all over the place. Hi, Biscuit. He's so silly. Let the baby go. Hi, baby. You're so pretty. Yeah, you got your haircut. You went to the booty shop. Oh, my God. Okay, so in this case, this patient is getting very, very sick. Guess what the ER told her? They told her that her ICP was near 200 and that she was about to have a seizure any second. She had surgery within a half an hour. Again, if one goes down, something else is going to go up. She was diagnosed with hydrocephaly. She still has it. She still has it. The clinical instructor a semester earlier told her to get her eyes checked. She did. These son of a bitches told her because she was so young, there's really no need to do the glaucoma check. If they had done the glaucoma check, they could have picked up on her hydrocephaly way before we did. You're never too young to get a glaucoma check because we're checking the pressure of your eyes, for crying out loud. Could have picked it up, could have, but they did not. Okay? So she is very, very much thankful that we didn't just let her put her damn head down in class. Okay, now you got it. ICP precautions. That young lady had all of these to worry about because if you hold your breath, you're increasing pressure. You blow your nose, that's increasing pressure. Vomiting, where is that increasing the pressure? Let's really do this, okay? Intra-abdominal. Coughing, interthoracic. Blowing, intracranial. Pressure up anywhere is going to increase pressure everywhere. What other pressure are we talking? Blood pressure. Know it. Understand it. Okay? So, you minimize suctioning. You minimize crying. Where it says minimize crying, do you see where I wrote sedate babies? You're not going to know that if you don't write sedate babies. Here's what I mean by that. You got to put them out. You just got to put them out. It sounds crazy as hell, but you got to drug the babies up because crying increases their pressure. Okay? Now, what kind of medications can we expect to use with this patient? I want you to add a category because you're trying to learn these damn meds. Benzodiazepines, huh? Benzodiazepines at the bottom. Add that. Let me put it up here because I'll be acting like y'all can't spell with the shit. Benzodiazepines. There you go, babies. You got it? Okay, now, so if you remember your group, benzodiazepines, these are anticonvulsants. Remember that? That's what they are, anticonvulsants. Okay, and then you have your antiemetics. And then you have your mannitol. You knew that. That's nothing new. Do you remember on the page when we did the NCLEX quickie, we talked about immunosuppressed patients? Okay, well, the next one are the precautions for them. This is your neutropenic precautions. And so if you recall, I told you I keep the avoids together, the no's together, and then a bunch of other crazy. But let me just point a couple things out, huh? Do you see where it says no attenuated vaccines? You gotta know your song. What's the song? Measles, mumps, rubella, varicella. Woo! If you don't do the woo, you're fucking up. Let's do it once more, okay? All right, so you ready? Measles, mumps, rubella, varicella. Woo! Oh, yes, yes, you're gonna pass. Yes, you are. Okay. Woo! No.